We have Elon Musk and his minions at DOGE. They are now threatening to cut up to half of Social Security Administration staffing. And then on top of all that, you have Mr. Musk claiming that Social Security is a Ponzi scheme. Social Security is not a Ponzi scheme. Paid out every benefit owed to every eligible American for over 80 years. All Senate offices are getting a whole lot of calls from senior citizens who are experiencing a great deal of fear and anxiety as to all of the confusion and chaos that is currently going on here in Washington. When we have the President and my Republican colleagues talking about cutting Medicaid by some $880 billion, let us be clear, they are not just talking about throwing millions of children and others off of the health insurance they have. They are also talking about cuts to community health centers, which receive about 43% of their funding from Medicaid, and where millions of seniors go to get their primary care. So cutting Medicaid impacts primary care. At a time when we have a major crisis in nursing home availability. I know that's true in Vermont. I expect it's true in almost every state in the country. Let us understand that Medicaid provides approximately 2 out of 3 seniors with the funding they need to live in nursing homes. Make drastic cuts in Medicaid, it's going to be harder for your mom, your dad to get into a nursing home or to stay in a nursing home. Medicaid would be cuts in Medicaid would be a disaster for seniors in nursing homes. But it's not just Medicaid cuts that worry seniors. At a time when the Social Security Administration is already understaffed, and again, for years, I have been hearing in my office, I expect other senators have been hearing in their offices from seniors who tell us they're calling up Social Security, they've got a problem, they are not getting a response, and the result of that is that some 30,000 people a year die waiting for their Social Security disability benefits. And in the midst of all that, in the midst of a crisis where Social Security is understaffed, where our response should be to significantly increase staffing so that Social Security can better respond to the needs of our constituents, we have Elon Musk and his minions at DOGE cutting some 2,500 of Social Security staff, and incredibly, they are now threatening to cut up to half of Social Security Administration staffing. And then on top of all that, you have Mr. Musk claiming that Social Security, which has paid out every benefit owed to every eligible American for over 80 years, claiming that it is a Ponzi scheme. Social Security is not a Ponzi scheme. Paid out every benefit owed to every eligible American for over 80 years. And then you have the President of the United States, State of the Union, lying about millions of people, 200 years of age, 300 years of age, imagine that, getting Social Security benefits. Seniors understand what all of that is about. They know that Musk and Trump want us to lose faith in Social Security, and that over a period of time, they want to give this indispensable program over to Wall Street. Mr. President, let us be clear. In America today, 22% of Americans living who are 65 years of age are trying to survive on an income of less than $15,000 a year. Think about that. 22% seniors in America trying to survive on $15,000 a year or less. Half of seniors are trying to get by on $30,000 a year or less. And everybody, frankly, I don't know how any senior living on $15,000, $20,000 survives. I don't know. high cost of prescription drugs, food, housing, keeping warm in the winter. I don't know how they can do that. According to the Organization for Economic Cooperation and Development, we now have the dubious distinction of having one of the highest rates of senior poverty compared to other wealthy nations. In America today, according to the latest OECD estimates, 23% of seniors are living in poverty compared to just 4% in Norway, 6% in France, and 11.5% in Canada. Yeah, we have more nuclear weapons than any other country. We have more billionaires than any other country, but we also have one of the highest rates of senior poverty of any country on earth. We might want to get our priorities right. Now, Mr. President, while my Republican colleagues would like to make massive cuts to Medicaid in order to provide more tax breaks to billionaires, some of us have a better idea. We think that it makes more sense to substantially improve the lives of our nation's seniors by expanding Medicare to cover dental, vision, and hearing benefits. In 1965, President Lyndon Johnson signed Medicare, one of the most popular and successful government programs in our nation's history, into law. Before the enactment, this is really quite interesting, before the enactment of Medicare, about half of our seniors were uninsured. Today, everyone in America age 65 or older is guaranteed health care benefits through Medicare, regardless of their income or medical condition. That is the good news. The bad news is that since its inception 60 years ago, Medicare has failed to cover such basic health care needs as hearing, dental care, and vision. The result: millions of senior citizens have teeth that are rotting in their mouths. They are unable to hear what their children say or unable to read a newspaper because of failing eyesight. Mr. President, this is the United States of America. We are the wealthiest country in the history of the world. Senior citizens should not be walking around with no teeth in their mouth. They should not be unable to hear conversations. They should not be unable to afford glasses so they can read a newspaper. The need to expand Medicare to cover dental, hearing, and eyeglasses is absolutely critical. Nobody denies that oral health, hearing, and vision are essential parts of health care. We cannot continue to deny seniors these basic health care benefits. Mr. President, we can no longer tolerate the fact that 26 million seniors and people with disabilities in America have no dental insurance and no idea how they will be able to pay for the very expensive dental procedures that they need. The results have been tragic. Nearly 1 out of 5 seniors in America have lost all of their natural teeth. 20% seniors in America have no natural teeth in their mouths. Disgracefully, 60% of our nation's seniors have untreated gum disease, which can increase the risk of cardiovascular disease, diabetes, and rheumatoid arthritis. Further, it is not acceptable that while nearly 2/3 of seniors over the age of 70 experience hearing loss, less than 30% of seniors above this age have ever used a hearing aid, primarily because hearing aids are too expensive. In my view, no senior in America should face isolation from their families and friends simply because they cannot afford the extremely high price of a hearing aid. In addition, we cannot continue to allow seniors with poor vision to go without routine eye exams or properly prescribed glasses. Poor vision can lead to injury, cognitive impairment, and depression. Mr. President, adding dental, vision, and hearing benefits to Medicare is not just good public policy. It will not only ease human suffering and improve the health of our nation's seniors. It is precisely what the overwhelming majority of the American people want. Poll after poll tells us exactly that. According to a poll conducted by Data for Progress last year, it found that 92% of the American people support expanding Medicare to provide dental, vision, and hearing benefits. And that is why, Mr. President, I have introduced legislation today with Senators Warren, Booker, Welch, Markey, Duckworth, Merkley, Blumenthal to do just that. Congressman Lloyd Doggett in the House has introduced similar legislation which has more than 110 co-sponsors. Now, I am sure that some of my Republican colleagues may say, well, you know, it's an interesting idea, it's a good idea, but you know, how are you going to pay for it? So let me tell you how we're going to pay for it. We are going to pay for it by requiring Medicare to pay no more for prescription drugs than the VA. Right now, we pay the highest prices in the world for prescription drugs, and that means significantly increased expenses for Medicare. By making sure that Medicare pays no more than the VA, which has for years, for decades, negotiated prices with the pharmaceutical industry, we can not only cut the price of prescription drugs for our seniors in half, we will save over $800 billion over the next decade, which would more than pay for this legislation, lower the cost of prescription drugs, and get the revenue we need to cover dental, vision, and hearing for seniors. Now, some of my Republican friends may also argue that this bill is not needed. Some Medicare Advantage plans already offer dental, vision, and hearing benefits. Yes, but what my Republican friends may not tell you is, one, seniors still pay thousands of dollars out of pocket because these private Medicare Advantage benefits are totally inadequate. Further, the nonpartisan Medicare Payment Advisory Commission has estimated that Medicare Advantage plans overcharge the federal government by $83 billion a year. In other words, Mr. President, if we are serious about waste, fraud, and abuse, hear a lot about that, we may want to take a look at the massive waste and fraud that is taking place with private Medicare Advantage plans. Those savings would also more than fully pay for this legislation.